In a world where crises multiply, consequences on populations and health systems can be observed at every level. You know this. Climate, because of economic factors, sanitary factors. These crises, of course, make access to healthcare more complex. Providing services, resources available are limited, and of course, governance is disrupted. It is therefore essential to modelize this in order to come up with solutions, in order to do something about it. Hello, I'm delighted to be with you today. My name is Sophie Anis. I'm a journalist, and I will be with you today in this this common thinking process on digital health in times of crisis. So there will be today presentations, roundtables, and there will also be the Odess award ceremony. Of course, you'll get an opportunity to ask questions. There will be a mic in the room. We will also be taking questions from the chat. And hello to all those who are online. Without any further ado, I'd like to ask you to give a very, very warm welcome to the General Manager of the Foundation, Pierre Fabre, Béatrice, Garrette. Ladies and gentlemen, good morning. Welcome to Odess, the headquarters of the Pierre Fabre Foundation for the 9th Conference on e-health in 1,000 countries. The Pierre Fabre Foundation has launched this observatory in 2016 in order to have more leverage for equal access to healthcare in line with its mission. The observatory carries out throughout the year investigations in order to identify innovative solutions that will improve access to healthcare and medicine in countries with limited resources, mainly in Asia and Africa. Today we have over 200 projects in 80 countries documented and referenced on our website odess.io in free access. Amongst them, 48 were awarded for their impact and for their potential for a scale-up, 4 of which today will be sharing the amount of 200,000 euros, with thanks to a network of experts and the Francophonie University and the Fondation Avenir. The observatory has documented the extraordinary development of digitalization for health. 10 years ago, what struck us was the big number of applications and connected devices in line with the development of mobile phone technologies. Lately, we've seen more and more platforms with different levels of information interoperability, data flows coming from community systems or hospital systems, feeding a certain number of steering tools for healthcare authorities. Now, although innovation concepts such as frugal innovation or social innovation are still relevant, what we see today is large swathes of healthcare that are rethought thanks to digital technologies. Now, of course, everyone is not moving forward at the same pace, and therefore it is crucial for us to make sure that digital solutions contribute to reducing inequalities and not increasing them. And last year, we had made a focus on gender inequalities and also on the potential of AI, which could also be a source of new digital divides. Now, for this year, healthcare in crisis, this was obvious for us because of the number of conflicts, their intensity, climate change and its consequences, questioning multilateralism and international solidarity. This, of course, led us to react. The systems are made more fragile, resources are being drained, whether human or natural. So the question is, how can digital solutions help provide concrete, fast answers on the field, but also contribute to more resilience for systems faced with crises. Now, as we use the statements of players on the field, we have spotted certain key elements: fighting disinformation, collecting data, mental health care. Today, we will be discussing, thanks to the expertise of our speakers, and we would like to thank them for being here today in order to share their expertise with us. Now, our discussions, as Sophie said, will also be followed online by many people who will also get an opportunity to put us to the question. Thank you very much, ladies and gentlemen, for your participation, and I wish us an excellent conference. Let's hope it inspires us and bodes well for the future.